If each of us lost 10 pounds before getting on a plane on United Airlines, the company would save $80 million a year. That's $200,000 per day that United Airlines would save simply because we weighed less. An analyst said this in the context of the surge in Ozempic and these weight loss drugs, because airlines are constantly looking for ways to reduce plane weight to increase fuel efficiency. One airline has already started weighing passengers, not your luggage, but weighing you. Now, this is not to charge you more, but to ensure safety of its flights. Okay, but I don't see airlines charging us per pound anytime soon. But you can see how weight literally impacts bottom line because of fuel charges. Because of Ozempic and more, businesses and the economy are about to change a lot. See, Ozempic could save companies millions of dollars, and not just airlines, but healthcare companies, insurance companies, and so much more. And companies are now even tapping into influencers to promote injectable weight loss medication. On the other side of that though, if I was running a food company, I would be totally freaked out right now because these drugs suppress appetites, and that means that I'm probably about to have a lot less customers. Walmart CEO already even said that people who take Ozempic are purchasing slightly less food. See, Ozempic is stealing headlines and shrinking waistlines fast. Celebrities swear by it, and research shows jaw-dropping weight loss, and the internet is going crazy. First, there's the celebrity cred. We're talking Elon Musk tweeting about feeling great after Ozempic, Chelsea Handler bragging about losing weight effortlessly, and even Andy Cohen admitting that it helped him too. Now, celebrities aren't exactly known for their medical expertise, but the number of people coming out to say that they are using Ozempic to help them lose weight is astonishing. And we're talking an average weight loss of 15 to 20%. But hold up, because Ozempic isn't some magic potion here. It's a GLP-1 receptor, which basically mimics a gut hormone that tells your brain that you're full. Think of it as a personal stop eating alarm system, but flashier because injections obviously. But here's the twist, Ozempic isn't approved for weight loss yet. It was approved for diabetes. So right now it's all off-label use, which means doctors are prescribing it for something that it wasn't officially designed for. This raises eyebrows and opens a can of ethical worms. The craziest part about all of this is the price. Ozempic can cost over $900 per month if you don't have insurance. So unless you're rocking Elon Musk level bank accounts, access might be tricky. And this creates a whole new dilemma. Is weight loss becoming a luxury good? But let's zoom out and see the bigger picture here and analyze how Ozempic is going to change everything. Imagine restaurants with half-empty buffets. Picture the diet industry scrambling as their shelves gather dust. Even airlines celebrate slimmer passengers because they're getting bigger profits. Plus, the social implications are real. Is Ozempic just another quick fix in a culture obsessed with thinness? Can it exasperate body image issues and create a magic bullet mentality that ignores healthy habits? Remember, lasting change requires more than just a fancy injection. Let's dive into 6 factors that are now changing as a result of this craze. Number 1, we'll start with the impact of Ozempic on healthcare. According to the American Diabetes Association, diabetes accounted for $327 billion in direct medical costs. A study published found that every 1% reduction in A1C levels, which is a measure of blood sugar control, with type 2 diabetes was associated with a 15% reduction in healthcare costs. Now, this is crazy because there is a direct correlation between having diabetes and productivity in the United States. So number 2, let's look at productivity. The total economic cost of diabetes-related productivity loss in the United States was $420 billion. A study published found that employees with diabetes had significantly higher rates of absenteeism compared to others. They were just less likely to show up to work. And research conducted by Harvard suggests that interventions aimed at improving diabetes management and reducing complications can lead to massive gains in workforce productivity. In fact, improved glycemic control among individuals with diabetes was associated with a nearly 5% increase in productivity. Number 3, let's look at the pharmaceutical industry as a whole. The global market for diabetes drugs was valued at $67 billion in 2020, and that's projected to reach almost $100 billion by 2027. That's according to Grandview Research. The success of Ozempic has spurred competition and innovation in the GLP-1 receptor market. Number 4 is consumer spending. Now sit tight because this one is a bit complicated. So diabetes medications like Ozempic could lead to a substantial cost savings for patients, because one study published in Diabetes Care found that every 1% increase in medication adherence was associated with a $65 reduction in healthcare costs per patient per month. And the average annual medical expenses for individuals with diabetes are approximately 2.3 times higher than people without those conditions. Number 5 is restaurants. The average American spends around 11% of its income on food. So what's going to happen if they just need less food? Well, with Ozempic suppressing appetites, restaurants are now having to adjust. You're going to start to see smaller portions, more healthier options, and food and restaurant companies are adapting to these changes by offering more low-calorie, low-sugar, and just overall nutritious menu items. This shift can be seen in the rising demand for healthier alternatives like salads and plant-based dishes. But at the end of the day, less appetite might still just mean less consumption of food, and that could be a big loss for food companies and restaurants. And number 6, finally, let's dive into long-term health outcomes. Diabetes is a leading cause of complications like heart disease, stroke, kidney failure, and others. Improved glycemic control and weight loss associated with Ozempic use has also been shown to reduce the risk of diabetes-related complications. For example, one study published found that for every 1 kilogram of weight loss was associated with a 16% reduction in the risk of microvascular complications among patients with type 2 diabetes. But I'm curious to hear your thoughts about weight loss injections and how you think it's going to help people and impact the economy. So let me know your take below and make sure you subscribe so you don't miss the next explainer.